Welcome to Ask the Doc. I'm Olga Villaverde. Today's theme should be easy to grasp, unless, of course, you're experiencing pain in your hands. Our hands, and by extension, our wrists, are vital tools we frequently use in our daily lives. From texting on our phones to strumming a guitar, our hands are crucial. But what happens when these essential parts of our bodies start to cause us pain, like you're seeing right there? We have with us Dr. Ouellette, hand and wrist surgeon, who's going to help us better understand conditions like carpal tunnel syndrome, trigger finger, hand arthritis, and so much more. And of course, we're going to answer your questions. All of this on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc. Thanks for joining us, the show where we encourage our viewers to send in their questions. And we're going to start it off right now with Dale, who reached out through our website, allhealthtv.com. Let's see what Dale writes. Hi, Dr. Ouellette. My husband developed a lump on his right wrist. Craig said it's probably a cyst or something, but I'm worried it could be a tumor. He thinks I'm being a little dramatic, so I'd love your thoughts on this. So, Dr. Ouellette, let me bring you in immediately. What are your thoughts on this question from Dale?
Well, this is not an uncommon question because a lot of times people go out with their golfing buddies and have a lump that happens right here, mainly over the distal radius and the carpal bones. So they notice it right in this area. And so when that happens, everybody's worried that maybe they've developed a tumor. And because it doesn't really hurt, but it's a lump there. That lump usually represents synovitis. In other words, inflammation that is being caused by underlying arthritis. And usually you can, if they think back, they injured themselves as a teenager or a college student playing football or soccer or something like that, and ignored it all this time. And it'd be nice to get an x-ray and see that, but most of the time I tell people, I said, we're going to see a slack wrist here, which stands for a arthritic wrist secondary to an old fracture or an old ligament injury. But if it doesn't hurt you, don't touch it. Carry on, keep doing all your normal activities. But an x-ray will confirm that for you.
All right, let's turn it over now to Zeke. And he sent us a question from YouTube, from our YouTube page, I should say. So here's his question, Dr. Ouellette. Hi, Doc. I'm a screenwriter who probably writes too much, as well as a hardcore tennis player who might be playing too much. Now, as a result, my wrist is killing me. I've been doing some of my own research and feel that I either have carpal tunnel syndrome or tendinitis. What can I do to ease the pain? Doctor, this is a question, and I have so many friends of mine that play a lot of tennis. Now, before we get to Zeke's question, I also want to share this fabulous video from our allhealthtv.com to our viewers. Let's take a look.
So carpal tunnel is one of the most common diagnoses that I will see in the clinic. If you do have carpal tunnel, what you're going to experience is, you see, this here is the median nerve. It's one of the three major nerves that travel through the arm. Now, the median nerve enters the hand through what's called the carpal tunnel. The carpal tunnel is a space created by literally the carpal bones and this ligament on the palmar side of the hand. Now, carpal tunnel syndrome is when there's compression of that median nerve for whatever reason. The reasons could be a traumatic blunt injury. It could be those repetitive cumulative traumas from poor posturing when typing or prolonged gripping with certain professions. Now, you'll see that the median nerve travels through the thumb, the index, the middle, and literally half of the ring finger. The other half of the ring finger and the small finger would be a different nerve. Now, with carpal tunnel syndrome, what you're going to experience is numbness through the hand, weakness. If it becomes a chronic issue, you may have some atrophy of the musculature of the hand. The hand may present itself in this form, such as a claw hand, from the small muscles inside of the hand called intrinsic muscles having poor function. So this is basically the anatomy of carpal tunnel. What you're seeing is that the median nerve is being compressed in the tonal space.
So Dr. Ouellette, with that anatomy of the hand, let's try and help Zeke out.
Well, a couple of things. So I'm going to assume that you're in your 30s to 40s. If you're an established screenwriter, you're playing a lot of tennis. And with that, you can have ligament injuries that are part of what's causing your wrist pain, which then cause your tendons to be angry because they're not able to stabilize your wrist. And the other aspect of this is if you have some carpal tunnel, that will cause your thumb to be weak. And when your thumb's weak, now you're asking these other tendons to stabilize even more. Your thumb is responsible for 50% of the power across your hand and across your wrist. So with that, it's worthwhile getting worked up for carpal tunnel. Also, whether you have any ligament issues. And one of the easy things to do right now is to get a splint that you wear, particularly something like a lion's paw. And it's named lion's paw, and you can go online and look it up. But be careful because you don't necessarily want anything else, just the lion's paw. And then use a topical anti-inflammatory over in the areas that it hurts, like Voltaren. All of this you can do over the counter while you're getting your appointment to go see a physician who needs to look at you from a ligament standpoint. Most common ligament issues would be triangular fiber cartilage, and that triangular fiber cartilage would be a laxity here on the side of your wrist. So watch as I turn my wrist off, and unfortunately, I was talking over the click that happens, but 80% dead people here. Consequently, don't worry that you do something to yourself. This is part of living. But you now have to protect yourself. So use a splint, particularly, for really heavy duty and use the Voltaren, and then see a hand surgeon who needs to look at you for carpal tunnel, ligament instability, which will then be the underlying causes of your tendonitis.
All right, doctor, thank you so much. So we got a really great question from Facebook, and this one's from Rivka. Let's see what they're writing to us today. Dr. Ouellette, my son 50 fell off his bike a few days ago. I'm so sorry, and came running into the house crying and holding his wrist. I quickly took him to the doctor, who said that 50 had a scaphoid fracture, put him in a sling, and that was that. My question is this: why didn't he get a cast? Oh, I like that question. Why no cast here, doctor?
Personally, he would have gotten a cast.
Okay.
And so he needs a cast. And particularly since he's 5, because he's got the rest of his life on the scaphoid. So
You should go back to the doctor and reevaluate this?
I would go to a pediatric hospital, actually. They're going to really know and understand this. So see a pediatric orthopedist, and then they can make a determination about the cast, because you do want to immobilize and let him heal. Now, again, it's very difficult to see that. So why is that? Because in part, because their bones haven't ossified, so it's difficult to see. But if he's claiming it's a scaphoid fracture, then there's something he sees, and it'd be worthwhile to get a second opinion with a pediatric orthopedist.
And doctor, would you mind just sharing the meaning of that word you just said, ossified?
Meaning that the bones are mainly cartilage in young. And so that cartilage has to turn into bone, and it takes time. And it isn't until you are about 18 that all your growth plates are healed, your bones are kicking in and really showing up in your wrist. Pretty much by the time you're 10, they're pretty well formed and you can see them. So he's in that age where it's tell.
All right. Thank you so much, doctor. Great information there. By the way, in case you missed it the first time, here's another opportunity to send in your questions. Take a look.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
And finally making an appearance here, we've got a question from Corazon. So let's see what she's writing us today and see what her concerns are. Dr. Ouellette, my 65-year-old mother was recently diagnosed with osteoarthritis in her hands. I guess this is a two-parter. What causes arthritis? And what are some effective treatments for seniors with arthritis in their hands and wrists? So we got a two-parter there, doctor. But before we get to those two questions, I do want to share a video from Baptist Health, our partners. Let's take a look at this real quick.
Hello, I'm Dr. Lester Caradegas with Baptist Health Primary Care. Osteoarthritis is the most common form of arthritis. It causes pain, swelling, and reduced motion in your joints. It can occur in any joint, but usually it affects your hands, knees, hips, or spine. Risk factors for osteoarthritis include being overweight, getting older, or injuring a joint. No single test can diagnose osteoarthritis. Most doctors use several methods, including medical history, a physical exam, x-rays, or lab tests. Treatments include exercise, medicines, and sometimes surgery. Contact your primary care physician if you're experiencing any of these symptoms.
All right, Dr. Ouellette, so let's go back to Corazon's two-parter, which is what causes arthritis and, of course, effective treatments, which I think we have a nice list for her to see as well.
Okay, well, typically what causes osteoarthritis is genetics. This is genetic. And in Sweden, they just linked it to the Neanderthal genes. And so this turns out to be part of our inheritance from Neanderthals, which is why it's also known as more of a Scandinavian disease. So you'll see a lot of papers come out of Scandinavia regarding this. So don't get uptight. It's genetic, and there's nothing you could have done to stop it. On the other hand, how can you minimize the effects of this on you? And that's the thinning of your cartilage that is genetically programmed to do that. So over-the-counter medications, you can take aspirin, Advil, Aleve. There's a whole aisle, and you have to figure out which one's going to work for you. So don't be flustered if one doesn't work for you, but then another does. So you're just going to have to keep trying them, and you want to try them for at least 6 weeks before you say that it doesn't work for you. It's not a one hit. You have to take it over time to see if it's going to help you. Physical therapy, the problem is that strengthening your muscles, particularly let's say for your spine or your hips or your knees, will definitely help your arthritis. But for hands, not so much, because there's really not that much muscle that's going to protect you. Lifestyle modifications in terms of no shame using a Black & Decker jar opener. We are known as tool makers, use them. And that's going to help you. And if you knit tight with heavy yarn, you may have to back off to a little lighter and knit a little looser. Hot and cold, you can use either, and either helps inflammation. And the key is, does it feel better? If it feels good, carry on. If it doesn't, do that. And so do what works for you.
I love that. If it feels good, carry on. All right, so let's carry on now with another Facebook question that we got here today. And it's from our new friend, Cameron. So let's see what Cameron writes to us, Doctor. Hey, Dr. Ouellette, I play baseball for one of the local colleges, and in the middle of a no-hitter, I get hit in the arm by a line drive. Coach took me out of the game, and now the team trainer thinks I might have nerve damage, which wouldn't be good. Any chance it could be something else? Oh boy, this could be a deal breaker for Cameron. What do you think, doctor?
Well, it depends on where he got hit. Okay, so that's number one. And what are some of the common nerves that get injured, particularly for baseball? One is the hook of the hamate with batting. As they go to bat, they'll break their hook of their hamate, and right by it runs the ulnar motor branch, so their hand will get weak. On the other hand, if he took a line drive to his arm here, and it hit the arm, then that kind of hit could hit the radial nerve. And will it probably be permanent? No, unlikely. And but it may require some surgery, particularly if it bled around the nerve, and the nerve gets pinched right at that point in what's called the triangular space. And so that's possible. And most of the time with this kind of blunt trauma, though, we'll wait and see if things wake up and get a nerve test at about 6 to 8 weeks. And you're also young. And young people have nerves that are truly zippity-doo-dah. They wake up, they do all kinds of interesting things. So I would not, hang up my cleats at this point, but I'd go get checked.
I love it. Zippity doo dah. Oh, you're so fantastic, Dr. Ouellette. Okay, really interesting question here from YouTube. Okay, so this is from Mavis on YouTube. Let's see what they write. Dr. Ouellette, I began feeling some numbness in my hands a few months ago and didn't think much of it. The numbness eventually transitioned into pain, a burning pain. When I visited my new doctor, he asked if I had diabetes, which I do. His diagnosis was peripheral neuropathy. What is it? And what can I do about this pain? Two great questions there, Dr. Ouellette. What are your thoughts?
Well, peripheral neuropathy, let's first go through that one because we can get rid of it pretty quickly. 70% of peripheral neuropathy, we don't know why it occurs. We don't have a logical reason. We do know, and there's some very specific things that we see in neuropathy caused by alcohol, caused by hypo or hyperthyroidism, diabetes. So that 30%, we can figure out who's causing what. And the thing about diabetes is it's very difficult to deal with that one. So then the number 2 aspect of it is it type 1 or type 2? Type 1 is the kind in which your islets of Langerhans in your pancreas have died and you're not making insulin. So you have to give yourself insulin. So then you have to make sure that you're very tightly regulated, because we know the tighter you're regulated for that insulin, the better the opportunity for you to not develop neuropathy. So it definitely improves the tighter your insulin is. If it is type 2 diabetes, which the majority of us have, issues with, again, we go back to talking about how to change your diet. And now a lot of people tell you, are you eating too much fast food? Are you eating too much food? Are you eating bonbons in the closet and not exercising enough? Well, the problem with type 2 diabetes is that it's the ghrelin hormones that get turned on to block insulin at the cell. And so the ghrelin hormones tell insulin, you may not work here. So the problem is the ghrelin hormone. Now, how do you get rid of that inflammation and that hormone? Very difficult. So there's a number of things just in terms of cleaning up your diet and going totally organic as much as you can. Use the apps that are out there to inspect your choices for food and your choices for soap and shampoo, etc. Because it turns out that is 30 seconds of crossing your bloodstream. So that can also cause you to be inflamed. So clean up everything in your life if you can. And that's going to help some of that type 2 diabetes and therefore that neuropathy. But now we get to the surgical side. And that is, just because you have neuropathy, and that sounds hopeless because it's in the nerve, can you have something that I call basically nerve math? 1 equals a problem, that's the neuropathy. But 2, if you've got compression of that nerve, that's 1 plus 1 does not equal 2, it equals 3. So we're out into your trigonometry here. It's an asymptotic curve, and it really jumps up there. So if you can take care of one of the problems, which is entrapment of the nerve, you will help improve the neuropathy. Therefore, it is worth it to consider surgery, both in your foot and your hand, when you have entrapment of a nerve. And so to do that, you need to see a neurologist who's going to do a nerve test and determine how quickly the impulses are getting across that nerve and where the nerve's getting pinched. And it's worth it to take the pressure off.
All right, we're going to get to a couple more questions, but in case you missed it just the first couple of times, here's another chance to find out how you can send in your questions to Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, so we're going to go to allhealthtv.com, and that's where we got a question from Vita, and this is the question from him. So let's see what he has to write. I'm retired and I play too much golf, at least according to my wife. Oh my goodness, that's funny. But she might not be wrong. I've been experiencing pain in my wrist lately, so I went to my doc and he thinks I have tendinosis. Isn't that the same thing as tendinitis? So he's playing too much golf, according to his wife, Dr. Ouellette.
Well, so a couple of things. Number 1, tendinosis is tendinitis. And number 2, golf, just like tennis, particularly has this TFCC tear. And so you can see as I'm moving my wrist up and down, that, this kind of slump here, and that's the TFCC tear. And it's particularly true in the left hand, because that's the hand that's going through and gets you that last kick of 50 yards. So that's one thing. And again, splints, there's something you can get online called a wrist widget, which will give you support for that. And again, the topical anti-inflammatories. Now let's talk about playing too much golf. Actually, it's not a problem. And I walk this through with my patients who feel a little guilty when they say, well, I just want to play. I said, well, it's important. It's important to your longevity. It's important to your cognitive decline or not, because you're out socializing and you are testing and playing a game and working with physics, and that keeps you lively. And you need to be with that lively banter. You need to be with those people that you've got that interaction with, and you've got a lot of steps that you get in. So wear your Apple Watch, measure them up, because golf course is a great place to get a bunch of steps, and that's going to keep your husband alive. So embrace it.
I agree. And it's a great sport. It's just so relaxing and it's all mental. I love that sport. Okay. So we got another great question via YouTube. And this one comes from Ophelia. So let's see what she writes. Dr. O, I went to urgent care a few days ago because my wrists were killing me. I'm talking severe pain. The physician on call there asked if I had a toddler. The question took me by surprise, but then he explained that many women with toddlers develop a specific condition from incorrectly picking up their children. Oh my goodness, this is interesting. What's the right way to pick up a toddler? All right, well, I passed that a long time ago, but I'm still curious. Doctor, what are your thoughts here? What's this condition?
Well, he's talking about de Quervain's tendinitis, and that's where you're lifting the child up and down like this. And of course, you're holding the child, and you've been doing this since they got born. So believe it or not, this really strikes people a lot of times in the first year as their hormones are shifting back to normal and as they're holding a baby, like this, etc. So one of the things that I tell people is there's only one time that you want to be doing this, and that is the car seat. So number two, okay, if it's only going to be the car seat, how on earth are you going to cope? Because this toddler wants up in your arms, right? Why do they want in your arms? They want to be in your face. Why do they want to be in your face? They're learning their language. So if you go look at pediatric development type stuff and all the lectures on that, you will find that little children 2 and under have to be in the high-pitched adult's face. Who's that? Us. Okay, so it's in mom's face. And so I tell people, go to ground. No more high chair. You're going to eat dinner at the coffee table. So the toddler can walk in and walk out and walk in and walk out, because they got to go out about 100 yards. They won't get 100 yards past you. And then they got to come back in and talk to you about the adventure of going out 100 yards. Mm-hmm. But you got to be available. Your face has to be available to them. If you insist on working at adult height, they got to get up there. So go down to ground. And deconstruct your couch so the pillows are on the floor, and so the child can crawl in and crawl out. You don't have to lift them onto the couch. No more diapers on the changing table, et cetera, et cetera. You get where I'm headed. Only the car seat. That's the main safety factor. Get on the ground, and that's going to help you a lot. And you just got to get through that hormone shift, which is after at about 2, your body's finally recovered from that first child, and then you're going to be on to the next one. But
and then you just do it all over again.
Splints and anti-inflammatories, but the anti-inflammatories you can't use most of the time because you're breastfeeding. And we really are moving back to that because we understand the immunology and the bonding that occurs between a mother and a child and how important that is.
I'm a huge proponent of that. I breastfed both my girls. So there's some personal information I just said on live television. Okay, doctor, we've got about a minute left. So I want to get this question in real quick from Sergio, and it's from allhealthtv.com. So let's grab it real quick so we can get it. And it's, hi, Dr. Ouellette. I found out that I have something called trigger finger. I don't understand. What is it and what's the cure? Doctor, again, I got about 1 minute. So let's take care of Sergio.
Tendon is going through right here into your finger. And it gets caught at a pulley right here. And so think of it as a frayed rope and a block and tackle. And so you're trying to pull a frayed rope through this block and tackle, but the frayed rope is too big. Ear, boom, ear, boom, as you're going back and forth through that block and tackle. So what we like to do is put a splint, and again, use Voltaren. So you can get a splint at the drugstore, an aluminum splint that holds you out at night, not during the day, just at night. So you don't land in one of these tight clenched fists over, 3 or 4 hours that really makes everything swell. And you might find that that helps a lot.
Great stuff. Dr. Ouellette, it's always so great to have you. So appreciate your time. I'm just going to give you maybe another 20 seconds. Final thoughts for our viewers.
Try and go as organic as you can. Try and clean up everything in terms of getting the toxins out of your life. And it is possible. So many things, even in the regular grocery store, at Costco, at Target, wherever, that you can find everything, including grass-fed beef, free-range chicken, et cetera, but you got to know what you're looking for. Go in knowledgeable, or go in with the barcode program that will help you.
Thank you, Dr. Ouellette. Thank you so much for your time. Appreciate it. And thank you for watching us. We'll see you next time on Ask the Doc. You take care.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.